Hi, good afternoon. Welcome to Friday Reading Live. This is me, Vandana PS, joining you from 𝐻𝐂 Academy. Okay, so we have another weekend is here. So what are your plans? May I know in the comments? Alright, so as usual, we will start with a sample question from part B. Then we will move on to the new topic from part A. So I'll give you 2 minutes. Then we will discuss the answer. So here is the question. Okay, so welcome back. Yes, I got a lot of messages here. Yes. Hi Anu, good afternoon. Reba, Abhi, Reshma. Yes, Reba, good afternoon. Okay, I think already you guys have done the question and you got the answer, right? Okay, a lot of answers. Okay. So first of all, I'm going to read the question. So that is the first step. Okay, read the question. So my second step is understanding the question. Okay. Then I'll underline the keywords from the question. Then I'll read the options. Then fifth, I'll mark the keywords from the option. Then I'll move to the paragraph. Okay, and I'm gonna use that strategy called elimination strategy here. So let's see what is elimination strategy. Okay, so the question is, what does this manual tells us about spacer devices? Okay, then I'm done with the first step. I read the question. So what is the second one? Understanding the question. Okay, so in which category the question falls under? Any idea, Anu? In which category the question falls under? Okay, Anasuya, very good, dear. It is manual. Okay, so what is a manual? What is a manual? Any idea? What is a manual? What is a manual? Okay, so manual. Alright, manual which we are reading for the main idea. Okay, Tessie, manual. Okay, Reshma, manual, I agree. So my question is, what is a manual? What is a manual? Okay, so manual, which means a small booklet that contains all the information regarding a particular device, machine, instrument, equipment or drugs. Okay, which I can say medicine. Okay, it will be a small booklet that contains all the information. For example, the functioning of a particular device. Maybe, yeah, example here it is spacer devices. Okay, so manual, which means a small booklet that contains all the information regarding a particular device, machine, instrument, equipment or medicine. Understood? Then, what are we reading for in a manual? Or what are you reading for in a manual? So you can say, we are reading for the main idea. Okay, so manual contains the main idea from this text. Okay, so which comes under the second category. Already I have told you, it is a manual. Then what are you reading for? We are reading for the main idea. Understood? Yes. Okay, then I'm underlining the keywords from the question. So what are the keywords? Okay, Reba. Okay, Reshma, it is particular about particular medication or device. Yes. Okay, Archana, Anasuya, yes, Anu. Okay, Reshma, Tessie, yes, Reba, this is a manual. Very good. Yes, everyone know that it is a manual. Yes. Then, so what are the keywords from the question? Let me know in the comment what are your keywords from the question. So when you read a question, maximum you can mark 3 keywords, not more than that. Okay, so what are the keywords here? So I'm marking manual, spacer, devices. So these are my three keywords from the question. Okay, then I'm connecting my question with my options. So what are the options here? Option A, patients should try out a number of devices with their inhaler. So my keywords from the first option is patients should, then number. So these are my keywords from the first option. Then what about the second one? They enable a patient to receive more of the prescribed medicine. Okay, so what are the keywords here? Then my keywords, they, enable and more. So these are my keywords from second option. What about the third one? Okay, children should be given spacer devices which are smaller than those for adults. So my keywords, children, should, then adults. Understood? So these are my keywords from these 3 options. So now it's time to read the paragraph. Okay, so what is a paragraph? Yes, manual extract, spacer devices for asthma patients. Spacer devices remove the need for coordination between actuation of pressurized metered dose inhaler and inhalation. In addition, the device allows more time for evaporation of the propellant, which means the medicine, so that a large proportion, okay, more of the medicine of the particles can be inhaled and deposited in the lungs. So from that particular line, I am just tracing my answer towards which option? Option B, second option, right? Then spacer devices are particularly useful for patients with poor inhalation technique. Then they can be used by children, patients requiring higher doses, nocturnal asthma, and for patients prone to candidiasis with inhaled corticosteroids. Okay, then the size of the spacer is important. The size of the machine is important. The largest spacers with one-way valve being most effective. It is important to prescribe a spacer device that is compatible with metered dose inhaler. Spacer devices should not be, it is compulsory that don't use a spacer device in connection with or regarded as interchangeable. So you can't change the device with one another. Then patients should be advised not to switch between spacer devices. See? So from the last 3 lines, I am just eliminating one option. Which is that option? I'm going to eliminate the first one. Patients should try out a number of devices. Okay, so it is not possible. They can't try out because it is not interchangeable and you can't switch between the devices. As well as it is not mentioned anywhere in the paragraph that patients can try out a number of devices. Where is it mentioned? Okay, so because of these 2 reasons, I am eliminating option A. So I am marking it is contradictory or opposite option. And what about option C? Children should be given spacer devices which are smaller than those for adults. So where is it mentioned? Children's spacer devices should be smaller. So not mentioned anywhere in the paragraph. Okay, so not mentioned. So through elimination method, so this is called elimination method. Got it? Yes. So I got, whether you like it or not, my answer is option B. Okay. Yes. They enable a patient, they help a patient to receive more of the prescribed medicine from the second and third line. Okay, if it is a manual or a policy, which lines are important? Any idea? Which lines are important? Okay, a lot of correct answers here. Yes. Okay, Reba, manual, which means giving instructions. Sorry dear, it's not about giving instructions, okay? Giving instructions, which means that you can connect with guidelines. Okay, if the question is all about guideline, you can say, okay, guideline is all about giving a lot of instructions to the reader. So it's not about a guideline. So we are dealing with a manual. So it's not about giving instructions, okay? Okay. Okay, Sharmila, yes, it is B. Okay, Kavita, yes, B. Okay, Prajisha, okay, Tessie. Okay, Reba, you eliminated option A, very good. Okay, option C, not mentioned, yes, of course. Okay, Anasuya, first 3, very good. So which lines are important? First 3 sentences are important while dealing with the second category, if it is a manual or a policy. Okay, I'm not saying that, okay, first 3 sentences will give you the answer. I'm not saying that, but the first 3 sentences will give you some clue towards your answer. You can connect with your options, okay? Okay, Prajisha, it is first 3 sentences. Very good, dear. Yes. All right. Okay, so that's all about part B. And how many questions in part B? There are total 6 questions, and these questions will be like multiple choice questions with 3 answer options. Okay, and they will not give you the direct answer, maybe just to confuse you. Okay, I'm repeating the same thing. Just to confuse you, they will give the exact same line from the paragraph into your answer option, but that will not be the correct answer. Okay, so correct answer will be in the form of paraphrased sentence. So what do you mean by paraphrasing? So paraphrasing, which means exactly the same meaning but entirely different sentence structure. So we have the tendency to mark that exact line from the paragraph, but still 95% I can say it will not be the correct answer. Okay, so please remember about that. And that's all about part B. So now it's time for part A. Yes. Okay, Reba, Reshma, 6 questions. Yes. Okay. Then, so what about part A? Yes, so we have a new topic here, that is aortic coarctation. Alright, so what about part A? I think today let's read the text and the questions, then we will discuss about the strategy, the time, everything. Is it okay? Okay, so yes, so what about text A? So what are the keywords from text A? So could you please comment, what are your keywords from text A? What are the keywords from text A? So we have 4 different texts, text A, text B, text C and text D. So it will be different from one another, as you know, and one of the texts will be a pictorial of something, maybe a chart or table or something. Okay, so what are the keywords from text A? So you can please comment, what are your keywords from text A? What are your keywords from text A? Yeah. Okay. So the keywords, that means the important words. While you read a particular text, you have to mark some important words. And those words will only help you to locate your answer from the question. With the help of these keywords, you can locate your answer. Alright, yes. So from text A, I'll read it Then we will underline what are the important keywords. So coarctation of the aorta is a congenital heart defect. So my keywords, the name of the condition, okay, as well as heart. Then it is also called aortic coarctation. This defect affects your baby's aorta, which is the largest artery in their body. It carries oxygen-rich blood from your baby's heart to the rest of their body. Coarctation also causes higher blood pressure in your baby's upper body and lower body blood pressure in their lower body. Your baby may have reduced blood flow to their kidneys, liver, and other organs in their belly. Babies who have coarctation of the aorta may also have other heart problems, including, and these are the other heart problems. Okay. Then, already in the last lines, they have mentioned about the prevalence of the condition. So, 4 in 10,000 babies in the US have coarctation of the aorta. Each year, about 2,200 babies are born with this condition. Of all babies born with some form of congenital heart disease, about 7 in 100 have aortic coarctations. Okay, so these are my keywords from the first text. Okay, so what about you guys? Okay, a lot of answers. Yeah, okay, Reshma, aortic coarctation, kidney, liver, baby's heart problem, all the numbers, very good. Okay, aorta. Okay, Prajisha, congenital heart disease, oxygen-rich blood, high BP, low BP, very good, very good. Kidneys, liver and other organ, yes. Okay, Kavita, aortic coarctation, congenital heart defect, largest artery, oxygen-rich blood. Excellent. Okay, so those are your keywords from the first text. So now we are moving to the second. So now tell me what are your keywords from the second text. Okay, Riba, your keywords present, birth, aortic coarctation, heart problems, ASD, 4 in 10,000, okay, US. Very good, very good. Yeah, okay. Yes, and I missed one thing and thank you so much for that. ASD, yes, the abbreviation is mentioned. Okay, yes. Then what about text B? What are your keywords from text B? May I know? Okay, keywords from text B. So complications of coarctation of the aorta may include a weakened or bulging artery in the brain or brain aneurysm. So my keywords are brain aneurysm, then complications, bleeding, okay, hemorrhage, dissection, so aortic rupture or tear, that is called dissection, enlargement in the part of the aorta's wall, that is aneurysm, premature narrowing of the blood vessels that supply the heart, coronary artery disease, stroke. If the coarctation of the aorta is severe, the heart might not be able to pump enough blood to other organs. This can cause heart damage. It may lead to kidney failure or other organ failure. Then complications are also possible after treatment for coarctation of the aorta. These include aorta re-narrowing or then re-coarctation, possibly years after treatment, high blood pressure, aortic aneurysm or rupture. So these are the complications, possible complications, okay. So these are my keywords from text B. Yes. So what about you? Complications. Okay, brackets after treatment complications. Very good, Reshma. It's all about, yes, brackets are very important. Okay. Then text C, it's all about a table. So here we have it's not a table, yes, it is a chart. So what is a chart? It's all about the study. Okay, so this is all about the study. Children with diagnosis of COA. So abbreviation is already mentioned. So 131, then the numbers, okay, surgery, then again brackets and numbers, I'm marking all the numbers in brackets, signs and symbols, okay, greater, less than 5, greater than 20, okay, then again the numbers, study population, excluded numbers, okay, all the signs, greater than 95th. So these are my keywords from this particular chart. Okay, Ribat, from text B, brain aneurysm, hemorrhage, dissection, coronary artery disease, organ failure, kidney failure, very good. Okay, all numbers exclude. Very good, I know it's all about text C. So now, text D. What about text D? Let me know. What are the keywords from text D? It is little bit lengthier. So yes, what are your keywords from text D? Of course, all the brackets. Okay, then all the brackets I am marking from text D. Yes, then what about the surgeries, the different methods? Okay, the methods I am marking. Then anything else? Names, resection, removal or something. Yes, incision. Okay, so these are my keywords from text D. Okay, so what about you? Any other keywords? All numbers excludes surgery, greater, equal. Okay, all surgery, names, brackets. Yes, the same thing I have already marked. Okay, so now we are moving to the text. Okay, sorry, the questions. So we have 20 questions in total and 1 to 7 set of question that can be called. Okay, match the following questions. Okay, so when you read the question, underline the keywords from each of the questions. So the first one, the conjugation between aortic coarctation and kidney failure. So where is it mentioned? The conjugation between aortic coarctation and kidney failure. So my keywords, conjugation, then coarctation and kidney failure. So these are my keywords from the first question. Any idea? Yes, Reba, very good dear. It's match the following. So what about your first question? Did you get the correct answer for that? Okay, very good, Prajisha. It is from text B. Now tell me, where is it mentioned in text B? Yes, Kavita. Okay, Reba, it is from text B. So where is it mentioned in text B? So what do you mean by conjugation? What do you guys mean by conjugation? What is the meaning of the word conjugation? Conjugation, which means that link, connection, okay, between aortic coarctation and kidney failure. So yes, that is mentioned here in text B. Okay, kidney failure as well as coarctation. See this particular point. Okay, yes. So that is okay, Vaishnavi. It is text B. Very good, dear. So now we are moving to the second question. Okay, Reshma, that line starts with if the coarctation. Very good. Yes. From those lines you will get, that is from text B, of course. Second one, finest procedure to make the narrowed portion of your baby's aorta wider. So my keywords, finest procedure, then wider. So these are my keywords from the second question. Yes. Any idea? Second one, finest procedure, which means, finest procedure, which means the best procedure or the good procedure. Okay, the best method. Okay. Oh, a lot of correct answers. Okay. Yes, Reshma, Kavita, Anu, Vaishnavi, Reba. Yes, Anu, Elias, it is D, from text D. So my answer is text D. Yes. And where is it mentioned in text D? This is the best procedure or this is the good procedure or method to make narrowed portion of your baby's aorta wider. Okay. As you can see here in the last paragraph, see the first line. This method involves making the narrowed portion of your baby's aorta wider. And this is the correct answer. Okay. So that is from text D. Okay. So the third one. Okay, Reba and Tintu, very good. It is text D. Okay, guys. So what about third question? The common intricacies evolve in people who have endured aortic coarctation. So my keywords, intricacies, then evolve, endured. Okay, intricacies, which means complications. As you know, intricacy, which means the complication, the common complications. Develop, evolve, which means it can develop. People who have endured, which means what? They are suffering with or existing. Okay, aortic coarctation. So what is the correct answer here? The third one, common complications. Okay, so the common complications which is mentioned in, very good, it is from text B. Yes. Okay, so that's all about the complications. Okay. Very good. Okay, Vaishnavi, Prajisha, Anu. Okay, Anu Thomas. Okay, Riba. Okay, Monisha. Yeah, that's all from text B. Very good. Then fourth one, supplemental heart problems that may exist in babies with aortic coarctation. Okay, supplemental heart problems, which means I can say other, other heart problems. Okay, supplemental, which means other heart problems that may exist in babies with aortic coarctation. So my keywords, supplemental problems exist. Yeah, what about fourth one? What are the other heart problems mentioned? Very good. That is from text A. Here they have mentioned about what are the other heart problems. So here we have other heart problems. Okay, and that is from text A. Fine. So third one, which is from text B, and the fourth one, text A. Then what about the fifth one? Oh, a lot of correct answers. Okay. Okay, Tindu, Prajisha, Reba. Yes. So what about fifth one? An atypical method, which means I can say a very uncommon or rare procedure conduct nowadays to treat coarctation of the aorta. So my keywords, atypical, then conduct, as well as treat. So what is your answer here? Yeah, fifth one. Okay, Kavita, your answer is correct here. Fifth one, which is text D. So the rare method. So that is mentioned here in text D, same like the last last line. This repair is rarely done. Okay, so which procedure? This subclavian flap aortoplasty. Okay, so which is a very rare procedure. So that answer is from text D. Then sixth one, total number of children with COA who were treated only by surgery. Okay, so the total number, then children, COA. So very easy question, and that is mentioned in text C, that study the group. Okay, so that answer is from text C. Then what about the last one, seventh one? The pivotal function of aorta. Pivotal, which means the important function. So my only keyword is pivotal. So pivotal function of aorta. So what is the correct answer? Seventh one. Okay. So, Kavita got the correct answer, right? Option A. Text A. What about others? Prajisha, okay. Seventh, text A. Okay, Reshma, A. Okay, Reba, Vaishnavi, it is. Okay, Reba, text A. Very good. That is from text A. And where is it mentioned in text A? Important functions. So, what are the important functions mentioned? Okay. So, they've mentioned here the function. So of aorta, it is also called aortic coarctation. This defect affects your body's aorta, which is the largest artery in their body. It carries oxygen-rich blood from your baby's heart to the rest of their body. So that is all about the function of aorta. Okay. Then, so now we are moving to 8 to 14, which can be called short answer questions. So what is important here? You can write it in a word or a short phrase, which means maximum 3, not more than that. So the first one. Okay, Tindu and Kavita. Okay, you guys got 7 out of 7. Yes, excellent. Anyone else with 7 out of 7? Oh, okay, Reba, Rijo, you got 7 out of 7. Excellent. Okay. Then anyone else? No. Okay, so now 8 to 14. Okay, Vaishnavi, excellent dear, 7 out of 7. Okay. So the first question, 8th one, what is the pervasiveness of aortic coarctation in the category of congenital heart disease? So my keywords, pervasiveness, which means the prevalence. Then category, congenital. So what is the correct answer here? What is the prevalence? They are asking you regarding the prevalence, the spreadness of the condition, pervasiveness. Oh my God, a lot of correct answers. Okay. Okay, Reshma, Sajiv, Prajisha, Praji, Anu Thomas, Anasuya Devi, okay, Adira Kunjimon, Reshma, Shivan, Monisha, Sarath, okay, 7 out of 7, excellent guys. Okay, so what about 8th one? That prevalence or pervasiveness of aortic coarctation in the category of congenital heart disease. Okay, Gina, Very good dear, 7 out of 7. Eighth one, any guess? So prevalence which is mentioned in text A, already we have marked that. So about, what is the prevalence in baby, congenital baby? So congenital heart disease, that is about 7 in 100. Okay, so answer should be about 7 in 100. Okay, so you can write, when they ask about, they're not asking you regarding the number, how many. If the question is how many, then you can only write the number 7 or 100. But question is asking you what is the prevalence, pervasiveness. So which means about 7 in 100. Okay. Okay, yes. About 700, yes. Then ninth one, surgeries that can be done through an incision in your baby's side are generally called as. So my keywords, surgery, then incision, cold. So what is it called? Surgeries that can be done through an incision, a cut in your baby's side are generally called as dash. Okay, so where is it mentioned? Oh, a lot of answers. Okay, Reshma, it is 7 in 100, about 7 in 100. Okay, Anu, Monisha, Riba, Vaishnavi, Adira, Raji, Kavita, Jeena, Riba. Okay, so the next answer is thoraco. Oh, yes, thoracotomy. Yes, okay, so that is the correct answer. And where is it mentioned? Thoracotomy, where is it mentioned? That particular surgery. In which text it is mentioned? Okay, Anu. Okay, Tintu, yes, Monisha. Yeah, where is it mentioned? You guys, answers are correct. So where is it mentioned, that particular surgery? Okay, so which is mentioned in text D, in this group of surgeries, from the second line. See, through an incision. That was my keyword from the question. So it is through your baby's side, another keyword, and this is in the bracket, thoracotomy. Okay, so that is the correct answer. Yes. Okay, it is from text D. Okay, Adira, Vaishnavi, Tindu, Jeena, Monisha, it is from text D. Excellent. Okay. What about the next one? Total number of children who got excluded during the diagnosis of COA. So excluded number of children. So total number of excluded. Okay. So what is the correct answer here? How many children are excluded from this? Okay, so here from the study group, excluded, it is 47. How many? So you can write just the number 47. Very good. Yes, it is 47. Yes. Okay, Reshma, Jeena, Anu, Thomas, it is 47. Okay, Vaishnavi, Raji, it is 47. Okay, Tindu, Reshma, 47. Very good. Then 11th one, a condition that is expounded as the premature constricting of the blood vessels that supply the heart. Okay, a condition that is expounded, present as premature constricting, decreasing, constricting, which means that decrease, okay, of the blood vessels that supply the heart. So what is the correct answer here? What is the name of the condition? Any idea? What is the name of the condition? Yes, it is CAD, or you can write coronary artery disease, because both mention, the abbreviation is mentioned as well as the full form is already mentioned. Okay, so that is from text B. Answer should be CAD. Okay, and where is it mentioned in text B? So premature narrowing of the blood vessels that supply the heart, that is called coronary artery disease. Okay, and I thought that CAD, that abbreviation is mentioned here, but I think no abbreviation is mentioned, right? CAD anywhere else mentioned? No. Okay, I'm so sorry. So that you can't write CAD because that abbreviation is not mentioned anywhere. So please write the full form, coronary artery disease. Yes. Okay. Then the next one, 12th one. The area of the baby from which the surgeon takes tissues to widen aorta is called. So what is that particular area? Okay, the area of the baby from which surgeon takes tissues to widen the aorta is called. Okay, any idea what is that particular place called? Yes, subclavian flap aortoplasty. Okay, so that is the name of the surgery actually, which comes under, in that particular surgery they have mentioned about the particular area. So what is the area? Okay, so that is from text D again. That area is called, what is the area called? That area is called subclavian artery. Okay, that area is called, the surgeon takes tissue from your baby's subclavian artery. So that is the correct answer. Okay, so answer should be subclavian artery. Then 13th one, the artery that carries oxygen rich blood from your baby's heart to the rest of their body. Okay. Okay, Prajisha, that is a small mistake, okay dear. It is not subclavian flap aortoplasty. Answer is subclavian artery, because we need the name of that particular area of the baby. Okay. Then, okay, Reshma, very good. Okay, Prajisha. Yes, Reba, Kavita, Reshma, Anu Thomas, Gina Varghese, Monisha. Okay, Kartika, Reba, Vaishnavi. Yes, Tindu, Reba. Okay, okay. Then what about the 13th one? Yes, the artery that carries oxygen rich blood. Okay, answer is, so my keywords, artery, oxygen rich, then baby's heart. Okay, so my answer is, it is from text A. See the first para. Okay, so what is it mentioned here? It is from aorta. So answer should be aorta. So where is it mentioned aorta? This defect affects your baby's aorta. So answer should be aorta. Very good. Okay. It is in the first paragraph. Yes, text A. Okay, aorta. Okay, Anu, Kavita. Yes, Gina, Vaishnavi. Okay, Reba. It is aorta. Very good. A lot of correct answers. Okay. Yes, Tintu. Yes, Monisha. It is aorta. Yes. Then what about the next one? 14th one. Last one. One of the convolutions of aortic coarctation that causes bleeding in the brain. So convolutions, which means the complications, the problems. Okay. Of aortic coarctation that causes bleeding in the brain. So what it is called? It is called, as we know, that is from text B, and that is called brain in the blood, which is hemorrhage. Okay, yes. Okay, Kavita, yes, it is from text B. Answer is hemorrhage. Okay. Then 15th one. Dash is a condition in which we could see a weakened or bulging artery in the brain. So what is a condition? And that condition is called brain aneurysm. And where is it mentioned? As you can see in the second text, very clearly they have mentioned that condition is called brain aneurysm. A weakened or bulging artery in the brain. That is called brain aneurysm. Excellent, yes. Okay, Anu, Prajisha, Reshma, Reba. Okay, Adira. Yeah, it is brain aneurysm. Then 16th one. If the coarctation is relatively small, the surgeon can remove the narrowed part of your baby's aorta and rejoin the two ends, and that is called resection removal with dash. With what? Okay. So that is again in text D. Okay. So resection with end-to-end anastomosis. Okay, yes, end-to-end anastomosis. Yes, and that is the correct answer. Very good. Then 17th one. If the coarctation of the aorta is severe, the dash might not be able to pump enough blood to other organs. So what is the correct answer here? 17th one. Okay, Gina, Vaishnavi, Kavita. Yes, Anu, it is correct. Okay, Reba, end-to-end. Yes, okay, Reba. Yes, Alina, Prajisha. Yeah. 17th one, that is all about. It is from text B. Okay. And the answer is yes. If the coarctation of the aorta is severe, the heart might not be. So answer is heart. Okay. Answer is heart. Very easy question. 18th one. Dash also causes, okay, high blood pressure in your baby's upper body, lower blood pressure, and in their lower body. And what is the correct answer here? It should be coarctation. See, coarctation also causes high blood pressure in your baby's upper body, lower blood pressure in their lower body. So answer is coarctation. Yes. Okay, Kavita. Yes, very good. Anu. Yes, Prajisha. Yes, Reba. Yes, Vaishnavi. Is this coarctation? Yes. And the second last one, 19th. Dash is rarely done. Yeah, already we know the answer, rarely done method. Today, because it is sacrifices the artery that supplies blood in your baby's left arm. So what is that particular procedure called? It is subclavian, okay, flap arthroplasty. So that is from here. This is the correct answer. Already we have dealt with this question initially. Okay, so we know that answer, it is subclavian flap arthroplasty. Yes, Reba, that is the correct answer. Then coming to the last one, total number of children who are the age between dash and treated with only surgeries 84. So dash, between dash. What is the correct answer? It is from, okay, text to see the study group. See, what is mentioned here? Current age between 5 and 20. Okay, 5 and 20, and that is the correct answer. So that's all about 20 questions. So may I know, anyone got 20 out of 20? Yes. Okay, Tindu. Okay, Zina. Yes. Okay, Riba, 5 and 20. Yes. Anyone with 20 out of 20? Okay, Anu, 5 and 20. Okay, Reshma, 5 and 20. Okay, Adira. Very good, Anu Thomas. You got 20 out of 20. Congratulations, dear. Excellent. Anyone else? Okay, Tindu, 18. It's okay, dear. Okay, Riba, it's okay. You just missed one thing. 19. Okay. Okay, Kavita, 20 out of 20. Yes. Okay, Vaishnavi, 20 out of 20. I'm so happy. Okay, Riba, 19. Very good. Excellent. Okay, so that's all about today's session. So please stay tuned for Monday, same time, and God bless you all.